Chief medical official at Homeland Security during the Obama administration. I apologize, also ran the response to the H1N1 outbreak. And the questions are all there because the officials don't really understand this virus, it seems. So for us, the question's, when do I go to the doctor? I mean, if it's the flu, the symptoms are pretty similar to coronavirus.
Right, that's correct. It's especially challenging at this time of year because flu is also being transmitted amongst the community. So really, I think you have to understand what your personal risk is for being exposed to the coronavirus. So certainly we've had some patients in certain parts of the country, but in other parts, the risk is still pretty low. And so the advice that I would give to people is if you fit into one of those high risk categories, such as you've traveled to one of those endemic countries or you've been around somebody that's traveled to one of those countries who is sick, that's when you should really go to your healthcare professional to be evaluated for coronavirus. If your risk is low, you haven't done any travel, you haven't been around any sick people, it's much more likely that you either have the flu or even the common cold.
What about things like travel? You know, spring break's coming up. A lot of people are going to be there. How do you know if somebody's been in the airport and they're infected, and how close do you have to be to them to be at risk for infection?
So the CDC guidance is about 6 feet, is about how far the virus can travel. And so a lot of that, though, depends on a lot of different things. So how infected the person is, what is the amount of virus and the things that they've been, coughing and things like that. So there's a lot of different play that goes into that on how close you need to be to infected individuals. It can survive on surfaces, albeit for a limited amount of time. So even if you're not next to somebody that's sick, there's still a risk you could pick it up on surfaces. As far as the travel goes, that's an interesting question. And I've had people call me to ask me about their travel plans, some to Europe, some to Central America. And I always tell them, I wouldn't let that interrupt your travel plans, but just be aware that this is a changing scenario. And so things may change rapidly where you may have to alter your travel plans. And the other piece that I tell them is you may travel to those locations but have nothing to do because of social distancing programs. Maybe they've shut down very common tourist places, things like that. And so it's always a balance of risk versus, is how badly is this going to interrupt my travel plans? But certainly if it's not a place where it's circulating right now, and I always caveat that with right now, I wouldn't let that interrupt my travel plans.
Dr. Alex Garza, some great advice. Thank you so much. We appreciate it.